Hello, I'm Dr. Raghvendra H. I'm a consultant rheumatologist at Manipal Hospital, Hebbal and Trilife Hospital in Bangalore. Today, let's discuss on osteoarthritis. Osteoarthritis, or otherwise known as Asti Sandhivat or Sandhivata in Asti Sandhivata in Kannada, is basically a common joint-related problem which people generally face above 50 years of age. It is basically a degenerative process which involves the joints, which happens due to wear and tear affecting the joints. Since it's a very common joint problem, many people in the population face these issues. The risk factors for this disease being obesity, people being overweight, the sedentary lifestyle can lead to this problem. Excessive wear and tear, like people in sports injuries, sports activities, can have excessive wear and tear related to the joints, and that wear and tear can lead to development of osteoarthritis at a later age. So coming to the symptoms of the osteoarthritis, there will be pain in the joints, and there will be stiffness in the joints after sitting for a long period. There will be some amount of noise coming from the joints. These noise could be very loud, it could be as a friction developing between the joints. Sometimes there can be a swelling noted in the joints. The common joints which are affected in osteoarthritis are the knee joints, the hip joints, the spine joints, and also the hand joints in some circumstances. Especially in familial scenarios, the hand joints can get involved. How do we diagnose this particular condition? So osteoarthritis can be diagnosed through x-rays of the joints. X-rays will generally show the gap between the bones reducing, that is the cartilage wear and tear. The cartilage can be seen more precisely in an MRI, and other investigations to understand the gait of a person and other things can help in understanding why a particular joint is developing osteoarthritis. Coming to the treatment of osteoarthritis, mainly as I've already told you, it's a degenerative disease. So it is basically excessive wear and tear affecting the joints, the loss of the cartilage, which is basically the cushion between the bones which helps in mobility. The greasy material, what we call as a hyaluronic acid, getting weaker. So as it is a degenerative process, we don't have a permanent solution to it. Identifying this condition early is very, very important. People with a lot of deficiencies like vitamin D, B12 deficiency, and some other forms of hereditary disorders can develop early osteoarthritis. So identifying if you are deficient in these things, improving the exercise in your regular days can help in preventing the progression in this particular disease. So the first form of therapy would be the lifestyle modification. So somebody who is sedentary would start doing exercises, strengthening the muscles around the joint. Say suppose there is a knee joint which is involved, so strengthening your thigh muscles. The hip joint is involved, so strengthening your buttock muscles, the lower back muscles. Hand joints, hand muscles or the forearm muscles being strengthened can help in improving the condition, improving the symptoms of this particular condition, and preventing also rapid deterioration in this condition. In forms of therapy, that is in medications, not many medications have been useful, and there's a lot of scientific research ongoing for this particular condition. Mainly it is for pain management, alternative forms of therapy to reduce pain, like some nerve related medications, some anti-inflammatory which could help in the joints. So physiotherapy and strengthening again forms, so lifestyle modification, physiotherapy and strengthening is the most important. In very severe forms of the disease, sometimes we also go for joint injection, like hyaluronic acid injection can be given to the knee joint to at least reduce the symptoms related to it. There are various other forms of injection which is given to the joint, like a steroid injection is given to a joint, stem cell injection is given to a joint, PRP injection is given to a joint. So all these are dependent on the various stages of osteoarthritis. So for knee osteoarthritis, we have around 4 stages. So depending on what stage a person is, we decide what form of therapy is going to be important. Lastly, if the gap is significantly reduced, the bones are touching each other, it's become very difficult for you to move around with this condition. A form of total replacement of a joint, like a total knee replacement or a total hip replacement, is done for these joints, which is like a permanent solution. The lifespan of the implant is for quite some time. So if you lead a healthy lifestyle, strengthening the muscles, maintain a good lifestyle, have a good weight, having healthy diet which would include a lot of calcium, protein in diet, hydrating yourself well, like drinking more than 3 liters of water. These are some of the things which people can practice to prevent development or at least rapid deterioration in osteoarthritis. So what I would say is, identify here to the pain coming from the joints early, address it, consult a rheumatologist or anybody who is an expert in joint assessment, understand why the knee or the joint is giving you pain, and if you take the necessary steps, you can prevent progression in this disease and you can lead a good quality of life with this condition. Thank you.